Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Today, we'll be talking about how music can complement healing in the hospital environment and what's involved in becoming a certified music practitioner. My guests are Ceara Curry Kilpatrick and Anna Gagnier, both from Upstate's Department of Spiritual Care. Ms. Curry Kilpatrick is a staff music chaplain, and Ms. Gagnier was a music intern who recently completed her clinical hours playing live therapeutic music at the bedside of patients to become a certified music practitioner. Welcome both of you to The Informed Patient.
Thank you.
Thank you so much.
Let me start by asking Ms. Curry Kilpatrick to tell us about your role as a music chaplain. How do you spend your days?
The role of music chaplain actually came out of my clinical pastoral education with the Department of Spiritual Care. I really wanted to explore using music as a complement to spiritual care, use it as a spiritual care intervention, a way of assessing folks spiritually. So it's something I explored, and eventually it ended up becoming a position. And primarily what I do is I work as a part-time chaplain, so I'm visiting patients and families and staff, providing spiritual care, and I'm using music to complement that, whether that be playing a song to get to know someone better, to exploring their music interests. Some people are really passionate about music, and it's almost a form of spirituality for folks. So music has just been a great tool to really get to know patients more spiritually, and also just to connect with them deeper, provide them comfort. It really accents a lot of the goals we have in spiritual care already. And another big thing I do is lead a hospital choir that actually goes around and sings to patients, families, and staff once a week at the hospital.
So tell me a little more about the choir. How many people are in the choir?
As most folks probably know, hospital rooms are a little small and cramped. So as much as we'd want to have more people, around 5 to 6 people is what we average. The choir is made up of both spiritual care staff, volunteers, even faculty over at the university join us too, and sometimes medical students too. So it's a flux of who's able to come and who's not, but we usually like to keep it around 5, 6, 7 people so as not to overwhelm the patients' families in the room.
Now, can you tell me a little about your music background? As a child, were you interested in music?
Yes, very much so. I definitely come from a musical family. Both my grandfather and my uncle are phenomenal piano players, and it's something I really wanted to learn when I was little. Like, I taught myself piano from old piano books. One summer, I took guitar lessons, and I've been playing the viola since I was 9 years old, throughout school, throughout college. So music's really been a big part of my life, and I really wanted to be a music therapist for a while, so I actually started going to school for that. So I had a little bit of experience learning what music therapists do, and got a little bit of that training before I decided I wanted to learn a lot more about spirituality too. But I did go to school for music as well. I dual majored in religious studies and music, so I have that background as well.
Ms. Gagnier, I wanted to ask you about why you wanted to become a certified music practitioner.
Similar to Ceara, music has always been a part of my life from the time I was very, very young. I began studying piano at about age 7, and I moved up through my schooling and education to learn several other instruments. I really wanted to become a certified music practitioner to use and reconnect with my lifelong love of music and my passion for music, as well as my love for caring for people. And being a certified music practitioner really has helped me to find deep meaning and connection with people. I love meeting new people, and I really feel that this work is a connection straight to spirit. This offers patients a chance to connect with a place of rest and calm and revitalization. So the certified music practitioner is the facilitator of that. And this happens in the midst of whatever patients might be experiencing on any given day, whatever challenges that they're experiencing in the moment as a part of their patient experience. Side note, many people think that certified music practitioners perform and take musical requests from patients. What we offer is on a much deeper level. So we employ the three M's. We meet the patient where they're at. We match the music to their state of being through observation, and we move with them in the moment to maintain a close connection, watching for any changes that we can observe. And we adjust our music accordingly, ongoing in a very organic way.
So, can you tell me what it was like to become certified? What was the internship like? What was that whole process of education?
Okay, so I began my studies as a certified music practitioner in the fall of 2023, and I've been moving the components of the program for the last 2 years. Basically, it involves weekend intensive education and modules with accompanying reading and discussion. Following that is the development of a repertoire and an exam. And then the certified music practitioner student secures one or more locations for a practicum internship. So I ended up doing my entire practicum at Upstate as it offered such a variety of patient conditions and situations. And then I worked on it beginning in June 2024, and I just finished at the end of June of this year, 2025. It was full of beautiful moments, challenging moments. It was full of being vulnerable and having courage. And I was really, really blessed to be able to work with the spiritual care team at Upstate and all of the other pastoral care intern team, which was so valuable for me coming in as not having a healthcare background per se. So after that, after the practicum, there was some paperwork and some reflection. We all had mentors. So I've been working with a mentor, mine is in Michigan, and also with Reverend Terry Culbertson at Upstate. And it's been just a beautiful, beautiful journey.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with two people from Upstate's Department of Spiritual Care about the use of music in healing, Ceara Curry Kilpatrick and Anna Gagnier. Ms. Gagnier, can you tell us, during your internship, did you come across some examples of the effects that this can have on patients?
Absolutely. There's a whole body of contemporary scientific research, and a lot of it is included on the Music for Healing and Transition Program website, which can be found at mhtp.org. They have a whole body of research included on the website that talks about how music has measurable physiological effects. For example, therapeutic music stabilizes heart rates in some cases, lowers blood pressure and respiration rates. And there's a whole bunch of studies that have shown diverse results, even that therapeutic music can have a positive influence on the protective cells of the immune system, for example, leading a patient into a state of deep relaxation and increasing endorphin production. There's also several more: reducing infection, affecting heart rate, aiding digestion, reducing stress. There's just so many, and it's just so exciting to think about the potential of therapeutic music to work towards improving patient outcomes and patient care in general.
Let me ask both of you, and you talked a little about the three M's, but how do you choose what music a particular patient will like and appreciate? Ms. Gagnier.
Ultimately, our offering for each patient is just that, an offering and an invitation. We always gain consent from a patient initially, and we take a moment to really get into that heart space of reflective pause in the moment and really see where the patient is on that particular day. And we pick music based on various aspects of the patient condition. For example, we have memory care music that addresses cognitive challenges. We have specific transition support music that we play in situations of palliative care and end of life, hospice situations. We have music that we choose for non-acute and acute situations. There's just a whole myriad and spectrum, and it kind of is wonderful because it can shift as you move. So we meet, match, and move with the patient. As far as repertoire goes, everything is game. I have everything from ragtime and classical pieces to pop music and spiritual Christian music and everything in between. So it's really a wonderful process of connecting with the patient and adapting to where they're at on an ongoing basis.
Ms. Curry Kilpatrick, can you talk to me about the types of instruments that are used?
Sure. With the hospital choir, we have a guitarist, actually two guitarists on occasion, and a ukulele player and vocals. That's really the extent. Like I mentioned before, we really don't want it to be too overwhelming. So we don't have a percussion section. We don't have really loud instruments. And like Anna talked about too, you really want to meet the patient where they are. So we think the acoustics and the voices really help to do that. And then when I'm going around by myself as music chaplain, visiting patients, family, staff as a chaplain, using music as a tool for spiritual care intervention, I usually just bring my ukulele or my viola.
What sorts of music are the most popular? Is there a genre that you end up using a lot?
With the hospital choir, because it's usually such a quick visit, we actually get a quick sense of what genres do folks like, just sort of offering something that they would appreciate. And we get a lot of desire to hear spiritual music, popular music, country, folk music. That's a lot of the genres we end up playing. And I'm sure Anna can speak to, it may be a little bit different for music practitioner, because with the hospital choir, we typically fall in those genres. We only have a quick 5 or 10 minute visit. So we usually play a song or two and that's it.
How do you choose which patients to visit?
We actually have a hospital choir list that's generated on our Epic system. It's based on other staff recommending us to the choir. Sometimes palliative care patients get put on the list. I also get referrals directly, either via my vocera or in person, or a family member or a staff, and I can manually add them to the list. And then we print out the hospital choir list and we do our best to see as many patients as we can, but we only round for about an hour and a half. So usually we only get to 1 or 2 units of the hospital per week.
And Epic is the electronic medical record that keeps all of the patients' medical records in place. And then you mentioned vocera.
So
Yeah.
the communication system that's used amongst staff and volunteers with the spiritual care department, to the nurses, to the environmental services. A lot of different staff use it for a means of quick communication from one department to another or one staff member to another.
Gotcha. Well, thank you both for making time to tell us about this. I appreciate it.
You're quite welcome. Thank you.
Wonderful to share.
My guests have been staff music chaplain Ceara Curry Kilpatrick and certified music practitioner Anna Gagnier, both from Spiritual Care at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.